A women's health charity in London have told City News that more than 3/4 of women would feel embarrassed if their period leaked in public or at work. Emma Thewlis investigates if the period stigma really still exists.
Yeah, I had to make up some rubbish excuse about IBS, and that felt more comfortable than saying my period.
The shame stigma silence effect, described by Rebecca White from Wellbeing of Women, is highly prevalent in the workplace, according to their research into the gender health gap.
55% of women have said they'd feel uncomfortable discussing their periods with their manager. Half said they would worry that if they took time off for period symptoms, it would negatively impact their career, which is, unfortunately, somewhat validated, because we also surveyed men and found that 35% of them said they would be hesitant to promote someone who frequently took time off for their period-related symptoms.
I think it's not something I've never known to be spoken of in the office. It's just it's not really about where I work, it's just work in general.
Even in the office, for example, if you're having really bad period pains, if you're in a mainly female office, it's fine, but if there's a man there, I immediately am I just can't mention it at all.
Katie Chico is a relationships and sex education provider for young people whose work aims to tackle the period stigma by going beyond biology.
Working in schools and universities across London, I do see the period stigma firsthand. Education is limited because it just focuses on biology rather than the emotional, social and also medical aspects. Boys are also rarely educated on it, which will then reinforce that stigma and kind of secrecy around periods. I think embarrassment and stigma exists around period health because periods are seen as a women's issue.
Beyond education, Rebecca explains what she believes can be done systematically to break down period stigma.
We think there's definitely needs to be more research into prevention, diagnosis and treatment of period-related symptoms and gynecological conditions.
In the wake of International Women's Day, what's clear is that more needs to be done if half the population feel they can't talk about something that happens to them every month.